Okay, welcome back to the show.
Coming back from Mars.
You see, they have rabbits there now and some other animal. They're not sure what it is. Maybe a dog.
So did we drop them off?
No, these are non-earthly animals.
Wow.
Okay, but we've got Dennis Chadbourne joining us here, homeopath. And Dennis, great to have you back.
Hi, good to be back.
Nice to see you.
So let's talk about, let's just give maybe a little bit of a review about what the cure is, because that's what you provide for people, right?
That's right.
Maybe you can just kind of give us a review.
Cureme has a specific, it's a name, but it also stands for the stages in which somebody will go through for health recovery.
Okay.
What I'd provide is a health recovery.
Okay.
Health recovery is, you know, just an option in the healthcare system, and I deal with usually the people that have gone through everything. Gone through the medical, gone through all the alternatives, and they come with me with, you know...
desperation as a last resort?
Yeah, just
okay.
about, yeah.
Okay, okay.
Yeah. The difference between what I do is I need time to do what I do.
Mm-hmm.
And it's very successful if I have the time to do it. We had talked a little bit about when cancer patients come in.
Mm-hmm. Last time, yes.
Yeah, and I just said if I have time to turn the body around and allow its own healing powers to start to work, then, you know, it'll be successful.
Okay, now you talk about, now you say you need the time, but is there a specific amount of time? I guess we're talking about the first 2 years.
Yeah, the first 2 years are critical because of the fact that within that 2 years, I am now turning the body around and getting it to respond the way it should.
Mm-hmm.
And getting it healthy and getting the systems running, the nervous system, the digestive system. In order to continue from that, we need the body to respond, because when somebody comes in, their body's not responding properly. It's not in balance. The chemistry is delayed, or the signals are not processing.
So what does that look like then? Somebody approaches you and they can't really, by the sound of it, have a really acute problem. Like the cancer can't be acute. It's got to be, there has to be time for the body to correct itself. So
right.
I'm just curious, what does that process look like?
Acute and chronic are two different things, but they're made up of the same thing.
Okay.
Chronic is a series of acute symptoms that have just accumulated into an acute condition.
Okay. Okay.
All right. The time I need is to unwind all the acute conditions that made up the chronic. That's a real simple way of looking at it, only because you know, you have a chronic, but you usually have 10 or 12 of related factors within that chronic condition.
You know, I would expect almost everybody has got some kind of a chronic problem that has the potential of turning into an acute disease at some point. But what are, like, for people that are watching this right now, what are some of the symptoms that they might be experiencing?
Or even some of the ideas that some of the things people have that are acute or chronic. Like, what kinds of things are we talking about? High blood pressure, diabetes?
It's everything.
Okay.
It really is. Say an alcoholic comes in, somebody that's dealing with being an alcoholic. Traditionally, all we see is the alcohol.
Okay.
And the addiction. Behind it is the process of the body. The body might need that alcohol.
Oh.
And therefore underlying a diabetic condition.
Okay.
But the diabetic condition doesn't just stand alone. There's chemistry that is altered by the need of that glucose from the alcohol.
Wow. Okay.
So that's a very simple.
So to Hugh's point, should we be looking at the symptoms, or should we be looking at the actual diagnosed illness?
The diagnosis helps, but it's how you feel. In everybody, we understand how we feel. We're the only person that really does. We know how it feels to get a cold, to go through a flu, or have asthma, or whatever it is. It's a cycle, and we all know it. Whether we think it's something that we're going to deal with, that's an individual choice. Usually when things start to catch up and they start to accumulate, that's when we start to find that we're running out of energy, we don't sleep properly, you know, they're just more accumulating symptoms. For me, if I have the 2 years, I'll turn it around and get that person back on track.
So for somebody that's coming to you and they're obviously going to be experiencing some kind of symptoms, or they're dealing with a diagnosis that they haven't had any luck in treating, what does the process look like when they start working with you?
Basically, I have a program that's set up to deal with the process. Okay, it's very structured. There's a lot of communication, and there is homeopathic remedies involved. Okay, it's a homeopathic process that I use as tools, but it's more about watching and understanding the cycle of the person. That will allow me to tell them what's coming next and what to expect. I can tell them that you're going to go through this, this, and this once I understand the cycle.
So do you sit down for, like, do you ask a lot of questions at that first meeting, or? I mean,
yes or no, it just depends on the individual. Some people come in and they're really tentative about giving out information. But I also give them a health form, and that health form really will give me a general direction. Within the first couple of months, I know where we're going.
If it's a 2-year process, Dennis, when do you start to see results?
The results will start to come into play in the 3rd and 4th year.
Third and fourth year. So you won't see anything for the first 2 years? I was thinking maybe, like, would I notice something in 3 months?
You will feel things after the first year.
Okay.
You'll feel change after the first year.
Okay.
You'll feel change after the 2nd year. But after once we get the systems working, then we'll start to see what the true symptoms are. So you think about picking up a mud ball. What's in the mud ball? A lot. Once you start to break apart the mud ball and see what it's built of, the water, the sand, whatever is in there, that's what we're looking for at the end of 2 years.
Okay.
And then your body starts to work on each one of them instead of trying to be, in a mud ball, you're confused of what to do first. After 2 years, the body knows exactly what to do next.
Wow.
Now, the term healing crisis comes to mind. First of all, is that something that someone you're working with might expect to experience? And what is that exactly?
Good question. A healing crisis is only something that the individual has experienced before. You'll never see anything new.
Okay.
So they already have the mechanisms to deal with that.
Okay.
So if it's a heartburn, they know what to do with it. If it's a chronic condition where they get bronchitis, pneumonia, they already know what to do with it. That's why I tell them not to change anything. Medication from the doctor's care. I'll tell them if the symptoms are serious enough, I'll tell them they'll be in the hospital in between 8 and 12 months. But they'll come out and there won't be any understanding of what's there because the symptoms aren't the same. The diagnosis can't pick up what it had in the beginning.
Wow. This is a completely different way to look at illness, isn't it?
Completely.
Can we talk about what some of the conditions are that you can treat that people might think are untreatable?
The most fascinating thing for me at this point, after doing it for about 8 years, is the mental emotional side of it. We hear about how mental emotional issues are affecting the workplace. They've always been there. But now it's an awareness that it's there. Those are the types of things that I think that at the 3 and 4 year that I start to solve. Those things start to clear up.
The mental and emotional.
Yeah.
things?
Because they're related to the chemistry in the body, which is related to the physical part of us.
Okay. So that's, but now how about some of the physical conditions that you can deal with?
I deal with heart conditions. I deal with individuals with scoliosis, arthritis, colitis,
Wow.
injuries, any kind of injuries. Why is that?
Diabetes?
Sorry?
Diabetes?
Diabetes.
Yeah. Wow.
Yeah.
Interesting.
Yeah. And it doesn't matter what the age is either. I can take a child that's been diagnosed with some sort of hyperactive disorder and change that perspective for that child. I can change somebody in their 70s or 80s into, they have different purposes, but at 70 or 80, you're just looking to live life so that you can live it out properly and not be relying on anybody.
Now, for example, a child that's been diagnosed with hyperactivity or something like that, maybe they've been put on a medication or something like that. Do you need them to go off that medication
No.
to be able to do your work?
No, we won't do that. And if they do come off, we will consult the doctor to take them off, because the doctor is the one that gave it to them, the physician or the specialist.
Do you find this a hard sell? Because you're asking people to commit to 2 to 4 years, and we're such a quick fix society.
Exactly.
Right.
So
Yeah.
do you?
It is. It's a completely different way of looking at your health. If you think that from a hereditary point of view, you think that you're going to be involved with some of the things that are in your family, why not take care of them before? Because we can. But it doesn't really matter.
So in that sense, it can kind of be used as a preventative if you're anticipating that.
Many of my patients right now are in, building 10 years before retirement, and they just want to enjoy their retirement.
Well, they're always telling us, we're so fast-paced, we're too fast-paced. We need to slow down. We need to step back.
And that's actually really forward-thinking, because most people, once they do retire, they're not well enough to do anything. They worked so hard, and
It's a percentage, yeah. It is a percentage. A lot of people are healthy, and they live life until something comes up.
wow.
Most of us are surviving very, very nicely.
So I would think much of your work is educating people and looking at this differently, as almost as much as it is in treating them.
Yeah.
Well, I think there's still a lot of people that don't really know what homeopathy is, or understand that there is this whole other approach to health.
Yeah. Yeah, it is. I'm a pioneer in the way I think about it. I'm also trying to change the way of thinking in the homeopathic world.
Well, the government certainly doesn't help us in that, though, because we don't have a lot of alternative choices out there, right? That they support in terms of OHIP and things like that.
Our government's doing the best it can, but every day we hear about how much the government's in debt, and that's going to play into our health system. What I'm doing is I'm actually taking away that responsibility of the government, if I can get it rolling into a significant program.
Well, plus I think if we had a health system that was a little more focused on prevention rather than cure,
great point.
In the long run, we're all going to save money, and we're going to have a much healthier populace.
Yeah. I have patients that have eaten healthy, exercised, but they still have things come up. It's inevitable.
So do you find it hard, though, because we tend to think, okay, well, why would I go here and pay for something when I can go to the hospital and it's already paid for? Is that a hard bridge to?
That's a really normal thinking. Everybody does it. And that's why when the hospital or the medical system doesn't work, then there's options behind it.
Okay. So people have to be desperate to kind of take it on.
Desperate
to pay
or
for
concerned,
themselves.
concerned for their own health.
Okay. So is there anything else we need to know about those first 2 years, Dennis? Or
there's more detail that I go in with people that I treat.
Yeah.
But that's more on an individual process. And
so I guess for people that are watching this right now, if they're resonating or they're at the end of their tether with respect to getting healthy,
They've exhausted everything else.
then if they want to get in touch with you and start the process,
Yeah.
or at least look into it, what's the best way for them to do that?
They can go to my website, www.cureme.ca, and start the process from there. All my contact information is there.
Okay, and we're going to get you back in a few weeks to talk. What's the next topic we're going to be
I
discussing?
think we'll venture into the last part of this, which is more of the me part, mental emotional side of things.
Okay. So me stands for mental emotional.
Yeah.
And what does cure? You mentioned
Cure. The letters stand for C is CURE are catalyst, utilization, response, and evolution, basically.
Wow.
There you go.
Very nice.
Okay. All right, Dennis. So cureme.ca, people can get started there. Thanks for coming in, and we look forward to
Nice to
having you back in a
see
few
you.
weeks.
Thanks for having me.
Okay. So let's take a break. We got singer Tiff coming on the show in just a couple of minutes.
Yay.
Actually, we got a song from Tiff ready to play here. So let's play it now, and we'll come back and chat with Tiff as Liquid Lunch continues. We'll be right back.